Hello, everyone, and thank you for joining us today for the launch of Investing in Healing, Health, and Hope. My name is Healy Thompson, and I'm the Senior Manager of Advocacy at the Stephen Lewis Foundation. Today's event is being simultaneously interpreted into French. To access French interpretation, please click the globe icon at the bottom of your screen and then select French. As an organization based in Canada, the Stephen Lewis Foundation acknowledges that our presence here is a direct outcome of the settler colonial state, whose policies of expulsion from the land and cultural genocide continue to impact Indigenous communities today. I am joining today's virtual event from the traditional territory of the Anishinaabe, Haudenosaunee, and Neutral peoples. This region is situated on the Haldimand Tract, the land promised to the Six Nations, which includes 10 kilometers of land on each side of the Grand River. As settlers, we have a responsibility to honor the treaties established on this land. This area is, in part, governed by the Dish with One Spoon Treaty and the Two-Row Wampum. The Stephen Lewis Foundation acknowledges that oppressive and inequitable socioeconomic and political systems in Canada continue to perpetuate this legacy of racism, intergenerational trauma, and structural inequality, and that this legacy is directly linked to the disproportionate impact of HIV on Indigenous communities within Canada. We at the Stephen Lewis Foundation are committed to working in solidarity with our community-based partners as they face the continued effects of colonialism and the HIV and AIDS pandemic in sub-Saharan Africa. This includes the colonial aspects of philanthropy and international development that we are discussing in today's event. As we work in international solidarity, the SLF is also undertaking a journey of ongoing learning, reflection, relationship building, and solidarity with Indigenous communities in Canada. So as we get started with the event, I'd like to cover a couple of logistics. First of all, a reminder if you're just joining us that we do have French interpretation. There's information about how to access this in the chat. You'll click on the globe icon at the bottom of your screen to select French. Also, we'd like to encourage everyone to participate actively in the chat today. Make sure that you select the box marked everyone so that your messages can be seen by the audience as well as the panelists. But in addition to the fantastic folks we have speaking as a part of today's event, we also have many folks with rich insight and knowledge and experience joining us in the audience, and we'd love to hear your voices today. I'd also like to note that in the interest of time, we'll not be reading the full bios of participants today, but my colleague is going to share a link in the chat where you can access those bios for all of today's panelists and speakers. Now, to give you a little bit of an idea of what to expect today. So we're scheduled for 90 minutes, and we're planning to pack a lot into that time. So I will start by talking a bit about the project that led us to today's event, and then I'm going to hand it over to my colleague Leah and our moderator Wojciech, who I'll introduce shortly. They'll set the stage for why we need to think about anti-colonial funding of community-based care. And then after that, Wojciech will moderate a conversation with 4 funding organizations and 5 community-based organizations about 5 anti-colonial funding principles. So, as you hopefully know by now, today, just 3 days before the 24th International AIDS Conference starts, we are launching a new document from the SLF called Investing in Healing, Health, and Hope, a call to action for anti-colonial funding of HIV-related community-based care. At the Stephen Lewis Foundation, we have almost 20 years of experience partnering with, supporting, and learning from community-based organizations in sub-Saharan Africa who are working at the intersections of HIV and human rights issues. We are committed to leveraging this experience to advocate within the HIV, feminist, and international development sectors for more effective support for community-based organizations and their community-based care work. Today's conversation and the call to action we're issuing grows out of that commitment and experience. Over the last year, we collaborated with 4 other funders and 11 community-based organizations supported by those funders on conversations about how to increase meaningful support for community and home-based care work led by grassroots organizations working in response to HIV. One of the things highlighted by that conversation and collaboration was the importance of funders and policymakers better understanding the vital role that community and home-based care play in the response to HIV and to health more broadly. Community-based approaches are an essential part of a comprehensive healthcare system. Investing in community-based organizations and their community-based care models fundamentally contributes to universal healthcare, including mental health care for all, maternal and child health, and the prevention and treatment of non-communicable diseases. To help make the case about why it's essential to fund community and home-based care work, the SLF released a web resource and report in April called Healing Health and Hope, Prioritizing Home-Based Care and Community-Based Responses to HIV and AIDS. If you haven't done so already, please check that out after today's event, and there'll be a link for accessing it in the chat. Since we don't have time in today's event to go in depth into what community-based care and home-based care are and why they're such an integral part of health systems, I wanted to play for you a 2-minute video that was made by one of our community-based partners, Kapewa in Kenya, that explains their home-based care model.
The design of our home-based care model is like this. We have the community health worker who is at the community and also at the hospital. So the hospital, people have come to check their HIV status. Once they realize they are HIV positive, our community health worker is right at the hospital. We'll take them in, bring them to Kapewa, link them to a support group in the community setting, and then ensure that they are also coming to the hospital to do what? To take their medicine. So it's all rounded. The community health worker is part of the pillar of the home-based care. They too are people living with HIV who are comfortable. They can say it, they don't mind, they are not afraid, they are going on with their life, and they embrace that idea. We think that that is a very powerful way to do it, using people who are themselves HIV positive. Another aspect of our work is that we allow the community health workers, they do something we call home visits. So during a home visit, a community health worker will actually visit a client, possibly who's tested recently positive, and they start to talk. And because this community health worker is also positive, they talk about themselves. This is how I started. I was almost dying. I was rejected. I did not know what to do until I joined other people. Our community health workers are volunteers. That's why we call them community volunteers for home-based care. And we give them a stipend at the end of the month. And we always feel that if they were full-time, like they become staff, then we would do more. It would be better for the impact, it would be better for the community work in all the areas that we work. I keep telling them, one day we are going to pay you. One day, and that day is coming soon.
So work such as that done by Kapewa and thousands of other community-based organizations has been instrumental in improving the health and well-being of millions of people and in significantly increasing HIV treatment access and adherence rates in communities across sub-Saharan Africa. And yet, these organizations continue to be drastically underfunded. But this is only part of the problem. The other is the focus of today's event, which is that far too often, the funding that is available for community-based organizations comes with extensive restrictions that undermine impact. To speak more to that and to bring us more fully into today's conversation about decolonizing funding practices, let me introduce Leah and Duseka with a reminder that you can follow the link in the chat to read their full bios and those of all of today's speakers. Leah Teklemariam is the Director of Programs at the Stephen Lewis Foundation. And Vuiseka Dubula Majola is the director of Stellenbosch University's Africa Center for HIV and AIDS, and also a member of the Stephen Lewis Foundation's board of directors. Over to you, Leah and Vuiseka.
Beautiful. Thank you, Healy. Good day, everyone. Morning, evening, afternoon, wherever you may be. Hi, Vuiseka. You know, we are having this conversation, at least Vuiseka and I, from Toronto, Canada. The Pope is also in Canada at the moment, issuing an apology to Indigenous communities here in this country for the systemic legacy of residential schools, which was a colonial, racist, genocidal, violent policy that was here in this land and affecting Indigenous peoples here. And I think it's useful context for this conversation as we think not just about what personal actions and intentions are, but also about the impact of our institutions and the way these systemic barriers, these systemic legacies of oppression exist within our communities, within our organizations, within our workplaces, within our homes today. And so that's something certainly many of us have been thinking about here, but it just shows the universality of these conversations and the importance of not just looking at the work that we're funding, certainly as donors, as funders in the philanthropic community, but also as we're turning that lens inward and looking at the change that needs to happen within our own institutions. You know, as Healy mentioned, we are here to launch a document entitled Investing in Healing, Health, and Hope, and to issue a call to action. So we call on funders to commit to an ongoing process of organizational reflection and to take concrete steps towards decolonizing funding practices. Using the lens of these 5 anti-colonial funding principles, funding organizations can strengthen their support of community-based organizations and shift power into their hands. So this event is meant to inspire self-reflection and introspection and conversation. None of us here are experts or the authorities on anti-colonial practice, but we want to continue holding ourselves and our institutions accountable and to have these conversations and really look at dismantling traditional power structures. So as Healy mentioned, we at the SLF are engaged in an ongoing process of reflecting on our own culture and practices, and are committed to having this conversation with our peers in the donor community. So we thank everyone who has participated in this process, and we also hope that this inspires more conversation ahead. So, but I want to start by talking to my sister here, Vuiseka, on some of these issues I know we both feel passionately about. So just in terms of thinking about the context for this work and this document, this call to action, can you talk about global solidarity and why that's a useful starting point when we're having a conversation about anti-colonial and oppressive practices?
Mm-hmm. Thanks, Leah, and hi to everybody. I think let's start by defining what do we mean by decolonizing, because often the term itself means many things to many people. Before we go to global solidarity, basically we're talking about a process of examining or a process of reflecting about the systems of power and legacies of colonialization that was there during colonization, but also after, and how the systems have lasting effects in how we engage each other. I'm talking about donor versus communities, but also it's about examining these Eurocentric norms of engaging with communities and how these norms have influenced whose solutions are important and where the solutions coming from, and how have we maintained those systems that needs to be dismantled in a way. Because in those systems, we're talking about white privilege, and the norms of thinking about solutions comes from white north and gender, mainly men. because those are systems of power that governs how we engage each other in the space of donor versus community relationships. I'm saying versus now because it looks like us and them, but it is because of the legacy of colonialism why we have this us and them, and we need to shift to a co-created space. We need to shift to a space where we see each other as partners. And for me, global solidarity means we are in this work because it is the right thing to do. It is also offering us a space for inclusive solutions. It is also asking us to think about this in a global solidarity way, in shifting the paradigms in terms of how do we not want to maintain the systems that oppresses others, and in what way in our behavior as donors or donor community perpetuating the same colonial ways of thinking. How do we change our practices to less oppressive practices? How do we change our practices to allow more partnership, more co-creation? Because the work we do is of a social public good. You're not doing it because we are engaging in a transaction. You are engaging in it because it is something that requires all humanities to find solutions to the global ills that we face. And some of them were left by the colonial powers of the time, and they are still there. So that for me is something that we need to engage, because it needs everybody as a partner, not as a donor, as a partner. And that then requires, in what ways do we need to think about as donors, how do we engage in that partnership in a much more equal way?
So, I mean, I love what you say in terms of shifting that paradigm, thinking about co-creation. That has certainly not been the norm to date. So from your perspective, what have some of the damaging effects been of that colonial, that top-down approach? What impact has it had on community, on social movements?
I think deep down, when we talk about, the lasting effects of colonialism is we have allowed a situation of structured racism. And that structured racism manifests itself in ways in which the North, particularly donors coming from the North, or maybe the donor community, doesn't matter where they are coming from, there's a sense of devaluing community solutions. There's a sense that community solutions are not well thought of, because there is this belief that because communities are seen as it's an empty vessel and there's nothing there, and we must come in and fill in that empty vessel. We see ourselves as capacity builders of communities, as if communities have no capacity. So it devalues, indigenous knowledge and ways of creating knowledge in communities, because though one can ask themselves, how have these people lived in those communities and built their communities without you? They were there and they were doing this very well. So you are not here to create something that people have not been doing. You are partnering with existing work that's already been. In fact, you are amplifying what others have already been doing. That, for me, the devaluing is an important thing, because it does get into people's psyche in how they then believe that our solutions are not important, and not believe in their own solutions, believing that the North must come in. For as long as the North is not coming, we have not done anything, because somehow it looks like you need to be validated and affirmed by the North for you to think that you are doing something valuable. That for me is at the core of the racism that has been perpetuated by the lasting legacies of colonialism. The other thing is I think often donors come with a control and a direct mechanism, like, we must tell you what to do, and this is how you do it, and this is how you account for what we've told you that you must do it. And that for me is, again, something that undermines ways in which we can do and create alternatives. And how do you do social public good without you having the voice, without you having the control, as if people don't have their own ways, mechanisms of accounting for what they've been doing. And that stifles innovation of communities, because it's a racist way of thinking that people of the land and people that have been there don't know how to do, innovative solutions of their communities. So we do need to think about what is the damage that we are doing into those communities in shifting their anatomy, in their way of doing things. And my example would be the example of Truth and Action Campaign when I was the leader of TAC. It's a social movement that has its own mess, and that in that mess, It's because life is messy. So there is no clean, neat template and clean, neat log frame, because life is not that. And so by asking a social movement to be clean and neat, you are asking us to be bureaucratic. And that bureaucracy comes at the expense of organizing the things you liked about the movement. You are killing it by all of these bureaucratic stifling mechanisms that you are bringing. Why can't we nurture what already people are doing and bring in things that amplifies the things that they do very well? That for me is part of the impact, the negative impact of what we are doing. And we think we are doing it very well. We think that that is the best way to do it, but whose norm is that? If it works in the North, it does not necessarily mean it will work in the South. And so how are we going to change the ways we think about how does community organizations want to show their impact? How do they show their impact? So buy into the existing ways of showing your impact rather than bringing your own thinking, this is how you show your impact. That for me is the legacy and the important negative impact, and which we still continue and perpetuate. And I sit in the board of SLF. It's something that the SLF in everyday behavior questions itself. In what ways is our behavior perpetuating this? How do we not do it? And I think this is a call for donors to really think deep and hard. First, it starts with acknowledging how have you been conducting yourself? In what ways can you change? And here is a solution. It's a beginning of a conversation. How do you do it? And here are the tools we are offering for reflection. And then we can co-create how do we get better at doing this? Yeah.
I mean, I think it's so important in recognizing that often the most important contributions that lead to impact are the community investments and the community know-how. So what would you say? I mean, this conversation for many donors is an uncomfortable conversation. Turning that lens inward is not something that many donors they're used to thinking about all the good that they're doing. Nobody thinks that they're a colonialist or they operate in colonial ways. So what do you say to our colleagues in the donor community that are uncomfortable in thinking about their work in relation to colonialism? What's the entry point?
Listen, I think where there is power imbalances and where the person who holds the power does not acknowledge their power and check in their power and their privilege, I think we have a big problem. The person who says, I am not colonial, that is the person who's colonial. Because if you are not colonial in the ways in which you are, first interrogate, in what ways could this be? And start listing it, and you will realize that there are some things we do naturally that we think are supposed to be the norm, but it's not the norm for the other. And in what ways have you not checked your power? And I think this is now something that I'm encouraging everybody to use the tension in a positive way. The tension of, it is uncomfortable for me to check in my privilege. It is uncomfortable, but it offers you an opportunity to engage with self and how have you behaved, in the environment with others. So for me, let's embrace this tension. First, acknowledge that it is possible that you are colonial, and then prove yourself that you are not by listing all the things that you are doing that proves that you are not, rather than arguing that you are not colonial, but then you are not asking yourself hard questions. So I think first acknowledge the problem, that there is a problem and we need to decolonize now more than ever. Two, we also need to be comfortable to be uncomfortable. Because if you are not allowing yourself to be uncomfortable, that there's something problematic about who we are, but not self-introspecting, because you can't self-correct something you don't know, you haven't acknowledged, and that makes you uncomfortable. But then in that uncomfortability, you are able to, say, I know this is wrong and I have not really checked in with myself. Then have the courage to have conversations. Don't sit with that uncomfortability and it makes you miserable to a point where you say, okay, because I'm so colonial, I'm not going to give anyone funding. No, open yourself to a conversation with community-based organizations who will teach you a lot about how you become decolonized, because they have the solutions and they know from the receiving end how bad this is. And I think let's open up ourselves to a conversation. And that conversation doesn't necessarily mean you can't change. We're coming from a place where you didn't know, now you know, but then let's change and look for ways in which we can do this better. And these 5 principles are beginning, it's a starting point for us to have that conversation. But you can't open yourself up if you have not first acknowledged that, you know, we still do this business in a very colonial way.
Beautiful. Thank you, Vuyiseka. I mean, that's the perfect note to transition to the conversation with other donors and funders and community-based organizations in doing this work. As you say, this is an ongoing conversation and an ongoing point of accountability for all of us in our daily lives, but also in the work that we do, particularly when we have the power and the position to navigate resources in the way that we do in the day. So thank you so much. I will hand it over to you and to our wonderful panelists and just wish you all the best for the rest of the conversation.
All right, we shift enough about me and Leah. So we're now going to conversations with community-based organizations and some of the donors who are opening themselves up for this conversation. But I think also to acknowledge that it's a difficult conversation. And definitely we don't have all the solutions, but we are at the beginnings of trying to unpack what this means and how this can also open up, you know, all of us to this conversation. So to discuss the first principle, I'm going to invite Tomeda from Banda from Firelight and Justin Chimangeni to discuss also the first principle. What does it mean for you? In what way can we respect the agency and expertise of community-based organizations by responding directly to their needs and priorities, implementing core decision-making processes and providing flexible context-specific? That will be the first principle to discuss. How do we do this? Because it's all well and good to talk about it. Share with us your insights, Tomeda and Justin.
Thank you, Vuyiseka. It's been a journey for us at Firelight to be able to do this. But when we partner with CBOs, we recognize that they already have a wealth of knowledge. So we're not coming to empty vessels. And because of that, we do not make assumptions that we know their problems and we therefore come in with ready-made solutions, with templates, with indicators of success and all that. But rather we take a step back. We are implementing what we're calling the community-driven systems approach, which includes a planning phase. And during this planning phase, this happens before we actually give them a grant to implement. We actually fund this planning phase where the CBOs are able to have discussions, they engage with their communities to resurface the root causes of issues that they want to address and identify potential solutions as a community. And they also come up with their own indicators of success, their goals of what they would want to see. So they are not using what we're imposing on them. So after this planning phase, when they then submit a proposal to us, it's based on these consultations. And after this, we give flexible funding of between 4 to 7 years that ensures that partners are able to plan long-term. So we've seen that by giving and recognizing the expertise of the communities through the community-driven systems approach, we're able to work with the CBOs and support issues that they have identified and prioritized themselves. And there's ownership right from the start. And then this helps to make the interventions sustainable because the CBOs and their communities are working towards the change that they desire, and they are able to identify other systems around them that they can work with. It's a messy process, I must say, but we have seen that it has really brought a lot of successes, and it has called on us as the funding partner to critically look at our systems, change our grant-making processes so that we really listen to the voices of the CBOs.
Thank you so much, Tomei. Justin, do you want to intervene?
Yes, actually, maybe what I would do is just to add on what Tomei has just said. So Firelight uses a very powerful development approach that we have seen and experienced over the years. We have been with Firelight. It is called the community-driven systems change. It is very empowering in that it encourages communities, CBOs, to consult their communities, where they work with the communities to identify their problems within the communities. They sit it down and discuss, maybe especially to find solutions that will maybe in how they will address, find ways of addressing those problems. So when they have actually found that, they come up together with interventions. But at this time, it's only the community that is doing this. And even the CBOs, when it is time for implementation, CBOs are only facilitators. They actually just facilitate different stakeholders within the community, including beneficiaries. They work together to solve the problems, maybe by proposing those solutions and doing them together. So it is a very good kind of approach that maybe it would please us if maybe most of the donors emulate this good example. And the other thing in this is in the CDC, community-driven systems change, the CBOs, they take responsibility of everything and they work together with the communities, which in turn ensures that there is also sustainability of the activities. They work together. And the other thing that we have also appreciated from Firelight using this system, they are very, very flexible. They even allow community-based organizations when writing their grant applications. They allow them to discuss or to write them in their own local language, the vernacular, like here in Malawi's Chichewa. They will allow you to write in Chichewa, even in reports, you put them in Chichewa, and they have translators that they will help them, to translate everything till you get to where actually they wanted to report about. So it is very, very empowering, as I've said, because in rural communities, even the people that maybe we talk of education levels being very low, in some of the CBOs, even you work with volunteers in the communities who are not that advanced in education, they will be able to do the work as a community together without any segregation to say, no, I don't know English, so I can't be part of this, or I cannot report. It works better. I talked also of flexibility in terms of their grant application. They have simplified it to a very small, maybe 2-pager or a page also. You can just explain what you want to do. You tell them what are your milestones, what is it that you want to do, and how will you trace that this is what we are doing, how will you monitor that? A very simplified version of the application, grant application form. So do that to communities. I think that is very, very empowering. And maybe another thing I would also, when we are working with communities, the CDC, the CDSC, Community-Driven Systems Change, encourages that CBOs should be working with communities and not rather than working for communities. CBOs must work with communities, not for communities. Because if they work with the communities, they move together, I think the communities will be able to actually own whatever activities they are doing. Even without funding, the communities themselves will be able to carry on with the activities.
I have one more question, Justin. I'm worried about time. I have one more question for both of you. You know, there's no donor that says that they are colonial. And I'm interested to find out from you, because I think it's easy to ask communities how are they accountable, but how is the donor community, your peers and yourselves accountable? What are some of the values that you hold that speaks to that accountability, but also allowing communities to also push back when you are pushing colonial ways of doing things? So how does that apply to you? In what way have you grappled with that within your own foundations?
Okay, I'll start.
Okay, Tomaida.
Yes, you rightly point out to say it's easier said than done. So for us, it has called on us to be very honest and critically look and challenge ourselves internally and look at the processes that we do when grant making. Because if we're saying that we're working together with communities and CBOs, our grant making processes should also speak the same. So we've had to overhaul our grant making processes. We've changed our report forms. We've changed the approach that we engage to use a solidarity approach as opposed to a charity approach. And we look at what we ask of CBOs. If we're talking about accountability, it should be two ways. It's not just the CBOs who should be accountable, but ourselves as well. So right from the start, we share all the information with the CBOs, how much is available, how much we're giving the partners over the entire partnership, but also we look at issues of even reporting on issues of beneficiary data. Are we just chasing numbers at the expense of quality? If we're talking about change, who's defining that change? So critically challenging ourselves and revamping our systems has helped us to make sure that we're accountable and being true to being to listening to the voice of the CBOs.
Thank you so much. Justin, 2 minutes.
Yes, I was also listening when Rea Saka was speaking. She talked something about this conversation being very emotional, even maybe to donors, but that's very true. And also, she also talked about the fact that if you do not know how to do it, go to CBOs, consult CBOs, consult communities. They will tell you how to do these things. So I think community-based organization, when they face such kind of approaches, I think it is very, very important for us also to sit down and engage the donors. Engage them, let's talk everything together, let's share ideas. This is how we think we can best do it to empower our communities. I think that one, if we come together, and funders also should be very lenient, should be very understanding. They should not really just come, but let's share ideas on how best, because at the end of the day, we need value for money. Whatever, if we're running projects, we need those projects to impact on people's life. So it's good that we come together, we sit down and discuss and see how we can move forward with interventions that are very empowering and the interventions that can be owned by communities at the end of the day.
All right, thank you so much. We are moving to the second principle. Thanks so much, Tomaida and Justin. And the second principle will be discussed by Ruth Mapara from Elma Foundation and Goodson Chavila. And the principle is providing multi-year grants as part of long-term investment in the people, infrastructure, and growth of community-based organizations and community-based care. And I see Goodson is online. So do you want to go first, or Ruth? I can't see both of you, sorry.
Okay, I can go first. Thanks, Vuyiseka, and thanks to the Stephen Lewis Foundation for this important conversation. I think it's important to recognize that social change or any meaningful change takes time. And for us at Alma, it's having recognized that it's about a commitment to long-term partnerships. It's a commitment to providing support over a long period. And how that has translated to us is providing multi-year funding support to our partners, and it's flexible funding. And one would maybe ask, why flexible funding? I think it's a recognition of the work that the communities are providing, that these are the right solutions. We don't need to necessarily come with projects. And all we have to be engaging with our partners and communities is saying, we acknowledge the work that you're doing, and we would like to support that kind of work. And this can be done through multi-year general or unrestricted funding. And that this allows for a holistic support, holistic provision for the partners. And also, whilst you're providing multi-year unrestricted funding, you're also recognizing that actually organizations are providing integrated support, and that integrated support is not a silo. So why would we think about supporting a particular project or particular activity when actually partners or communities, community-based organizations are providing integrated support? And the value that we have seen in this is in providing long-term support, in providing multi-year and general support. We've seen partners improving on the activities, on the programs that they're funding, and funding some of the operating costs, resulting in staff retention, or either hiring expert staff. So those, and I just wanted to speak to how some of the partners have improved on the programs. We've got a partner in Lesotho who, because of the flexible funding that they have, they've been able to shift some of their programming in response to some of the emerging needs. So in the initial activities centered around providing support to children affected by HIV, and with the success of PMTCT, we saw them shifting that kind of work and pivoting to supporting malnutrition, because PMTCT was successful, but then they saw that actually there's a need for nutritional support within the communities. And having that flexibility with the funding, they were able to quickly shift and adapt some of their programming. So I think it's important to be considering that and looking at, when engaging with partners, they have the solutions really, and all we are doing and coming and is supporting that work and amplifying that work so that we deepen the impact, to deepen the reach, and really ensure that the quality of services actually also improves. Over to you, Goodson.
Thank you, Ruth. Goodson?
All right, thank you very much. For Matunga Center, the long-term flexible funding gives us the possibility to focus long-term on programs that benefit on such commitment. And for example, like our home-based care program brings the most vital health on such commitment that people in the community, in the village, those we are serving, are receiving recommendable health services. It helps us to reduce congestion in the hospitals. It provides us transport to the hospital for the patients who may not afford to go to the hospital in time. And this also reduces some defaulters on maybe when we are dealing with the ART services. We have been able to reach clients on time saving. And during COVID-19, we were able to use flexible funds to construct a school block so that we can be in line with the COVID-19 protocols, of which is very essential to the community. And it also assisted the learners to learn comfortably because they run out of spaces due to COVID-19 protocols. In the countries that infrastructures are poor, poor population, health care, if it is driven to the communities in their homes, in their communities, this is very effective because the need is brought to the community at their hand. So it really assists in the communities. Maybe I can proceed to say there are some programs which we feel we face some challenges, especially on the restrictions from maybe the funders. This is really challenging. Many programs only exist because there is we see that the electricity will be a need, water, maybe drivers, a space for maybe offices, rentals, and the like. Then we need also some experts or some community nurses to work with the patients in the communities. But sometimes you find that you have some changes on limitations to say our funds does not allow you to do maybe on salaries or on motorbike services, or if you are not supposed maybe to hire maybe someone who is an expert in a specific area, then to us it's somehow a burden because we need also to source for some funds to complement that activity. And we feel to say if we can have a holistic approach that might assist us. But when we just isolate on a component, on the ground is too difficult maybe to carry out our services smoothly. Likewise, when maybe I can talk of on our questions, it also links to the sustainability issue. On sustainability, maybe we can define it in a different way. There are a lot of measures we can talk about sustainability. You find that maybe on health, that means health lives, inclusion of women and children as well. There are some of the expressions, even on the internet, there are a lot of expressions. So for the organization, the sustainability of organization is much more that an organization could learn without a donor, of which is too difficult in the countries which are economically unstable. Even if maybe you can start to say, let's start maybe an income generating activity, but if the country itself is far much behind economically, how will we sustain that? It's too difficult. Then we feel to say if some funders might be more flexible and we have long-term funding, that would really assist us in coming up with the appropriate programs which may save a lot of life in the areas where we are implementing our activities. Furthermore, maybe I can say, yes, when we talk of sustainability or resource sharing, that means it's about sharing the resources for those countries who have enough to those who are less privileged. And it takes in minds of us, the recipients, to see that there is justice and accountability.
Mm-hmm. Can I bring Ruth back on the question of sustainability? And
Yes,
how, from your view, from Elma, how do you deal with the issue of sustainability in the sense that sustainability is not just about financial independence from the donors, but in what ways, when you partner with communities, you think about legacies? What kind of legacies are you bringing in terms of what are you leaving as an infrastructure in that community-based organization? What support have you built over time to build that and planned for that sustainability, rather than, oh, we're talking about a project and it's short term, we'll give you this money, you must figure out how you're going to sustain it. In what ways can we figure this out and allow at least some conversations with other partners in the donor community who have not thought about that?
Right. Yeah, I think we should be looking at sustainability beyond just financial sustainability or financial independence. It has to go beyond that. There has to be a balance. Whilst financial sustainability is important, but we also have to look at what about the program sustainability, the quality of services that the organizations are serving. So it's important to bring in, when talking about sustainability, it's important to bring in sustainability of programs, sustainability of the organization. If an organization is not providing quality services, for example, it's not serving the community at the end of the day. So I think it's important to be looking at, in addition to financial sustainability, improving the quality of services, including the quality of the programs that the communities are receiving. And also, when talking about sustainability, we have to tap into the potential of community-led initiatives, community-led development. And that's how we can achieve true sustainability of anything. Because if you think about a child who has been supported, who grows and thrives, ideally for sustainability to be there, that child, when they've grown into being an adult, comes back and contributes to the community. That's what we can start talking about sustainability of anything, when we don't have to repeat the same cycle, same intervention and support for an individual community. It's, are we able to continue that support? Have we addressed the needs? And how do we move away from that? So it's really important to move beyond financial independence, but also to be supporting sustainability of the organization, program-wise, organizationally, and working closely with the organizations and saying, what are your needs in terms of capacity strengthening? What is it that you are defining as sustainable? And let's work together to support that process. So it's quite, and that's how we've approached it, that engagement with partners, really trying to understand what is it that they're defining as sustainability, and then working through that as part of that, because we're partners. And if you're partners, you're not coming with this is what needs to be happen. It's about let's work together and acknowledge the existing knowledge within the communities, within the organizations, and that can lead to sustainable programs, sustainable organization.
All right. Thank you so much, Godson and Ruth. We are moving to Principle 3. We will come back at the end with some closing remarks and some reflections. There's a lot of good suggestions also on the chat around what new language are we going to capacitate ourselves with? What some of the colonial language we've been using, and how do we not own that language and create alternative language in how we are referring to each other? And I think there's a lot that's going on the chat for those who can see it. So I'm inviting Leah, Ndinini, and John to discuss the third principle on how do we expand traditional approaches to demonstrate impact in community-based health initiatives and ease this burden of reporting. In fact, reporting to death, that becomes the work. The work is reporting, not the work. So I mean, with SLF, and you'll probably share how you've been doing it and how are you engaging with communities who are your partners in how do you get better in taking on ways in which alternatives ways within which we can ask for reporting, but in a more respectful and partnering way. Okay, who's going first?
Happy to jump in.
Okay.
Thanks, Boycetta, and thanks to everybody that's gone before. You know, I feel like the SLF, at the core of some of the work that the SLF does is investing in relationships with folks. I feel like it is at that micro level where trust is built, where a deep understanding of context is generated. And so for the SLF, and you know, I had a teacher once tell me to ease into the discomfort, and I feel like that's an ongoing conversation of the SLF is continuing to think about how we can create systems that are respectful, that engender trust, and a commitment to mutual respect and understanding. And in the context of impact, that can be challenging. For the SLF, we work with 120 plus partners, and they're all doing their own scopes of work. We don't implement projects. We fund what partners want us to support them with. So whatever is priority for them is priority for us. And so with that comes, you know, a bit of a challenge in trying to really define what impact looks like. And the way that we've gotten around that is to start having quite open and honest conversations with partners to understand what impact looks like for them. And to ask questions about, you know, questions that are like, what are you most hopeful about for the work? You know, what is most, what have you found the most useful and impactful in the work that you're doing? And to generate stories from these rich conversations about the impact that partners are having and a diversity of and different levels of impact that they feel like they're having across the groups that they work with. And that really comes from a genuine desire, I think, to listen and to hear what partners are sharing with us. We work with field representatives who are activists and community mobilizers, who some of them live in sub-Saharan Africa themselves. And it really is to sit with partners and understand what this work looks like for them, what the journey to date has been for them, and what stories of change are evolving in their communities for the organization itself, because organizational change is equally a compelling thing to learn and understand about organizations' visions for themselves and the impact that they're able to have internally as a team, as well as the work that they're contributing to within their communities. And so it's an ongoing conversation, and an ongoing conversation to develop tools that can meaningfully reflect on these processes as well. We're right in the middle of such a journey with our partners, and we know it's a conversation that will keep going. So I think I'll stop there.
Sorry, Leah, if we do get a chance to come back, if you can maybe talk to how do you deal with organizations who are deemed high risk by other donors, who are deemed too messy, deemed they don't have due diligence in place, but yet they do amazing work in their communities. What are some of the ways in which we can also dismantle that language? What is due diligence? What is high risk? And how do you deem an organization high risk? So that also, I mean, because that's a language that is very prevalent in the donor community.
For sure. So,
You can come back to it if I do get some time.
okay, awesome.
From Dinini. Okay. Dinini, do you want to go next?
Yes, thank you for having us. It's really amazing that we're talking about this because we at Mwedo, the Maasai Women Development Organization, we feel like we have experienced all this. We've experienced being some of the most rural indigenous community organization that's probably high risk or probably unreachable to some extent with other donors who like maybe to support us. And it has been a long time since we have worked in our communities. And one thing we have done for sure is to prove that we are capable and we have the knowledge that will improve the lives of our communities. And we have done that so many times with partners who are willing to learn together with us. And this is really more of our model, and it's our model because it's part of our indigenous principle. At a cultural level, we work together with traditional leaders, we work together with communities who have the knowledge of how to go about the environment, how to go about, their healthcare, and, we learn from them, but at the same time, we want others to also join us in that learning. And in doing that, we can all implement projects together. And at the end of the day, we can look at results in a different way from just seeing the numbers. And this is something that I have been part of myself as the director of the organization. I have been involved in many evaluation, but in many assessment as well, in a lot of due diligence activities with other CBOs. And we have been able to really convince donors and other partners that that is not necessarily the most important thing. What we want to see is the changes that are actually happening to this community. And we feel like we have learned that because we have already been enjoying the results, or we have been enjoying the kind of relationship with partners like Stevie Lewis Foundation. Stevie Lewis Foundation is a very long partner of the Maasai Women Development Organization. And I think our partnership started long since 2010, maybe even beyond that. But it's amazing how we have been able to convince more partners to join that channel together with us. That impact, it has a lot to do with the community changes and really seeing what is happening, or rather what is good within the work that we do. In regard to the reporting, I think it goes along with accountability, but also transparency among partners. It's not just about the CPOs or the community-based organization being able to report properly or according to the templates. It's really about trust. And we, again, have done this together with organizations that have allowed themselves to be engaged in what we see as the most important way to report. In other time, we've been able to even change the templates, or rather change the procedure in which the donor will normally want the report to come or to look like. And so in doing that, we've been able to share more of what we are interested in, including storytelling, including showcasing our sort of cases of win-win situation that we felt like this is something the donors should see. At times, it's not even a requirement, but because we wanted to showcase what we have done, and apart from just writing, which we are not so good at either, we have been able to show more than what is being requested, and which we think should really be the case in most of our communities, especially those rural communities.
Thank you so much, Dinini. John, do you want to come in? Yeah. You are on mute.
Yeah, so thanks. Thank you so much. for me as an organization, as a community person living in Kenya, and also living in most part of the country, and especially in the urban area, and also working in the rural areas in Kenya, I think for us as an organization, we had had a very good relationship. First, I want to say thanks to Civil Lewis Foundation for being lenient on in terms of the reporting, on how we do the reporting and all those kind of things. I think for me, it's a process. If you start a process with someone or with a donor, or how you participate, it's all about genuine partnership. It is not about like, I give you funding, I have to coerce and all those kind of things. So for us, it has been a relationship. It has been a partner for us to work together. But people and donors are totally different. There are donors who are totally different. And also some of the challenges that maybe people go through is because people maybe don't agree with how we need to report to a donor, or on how we agree with the donor. And especially in the terms of the challenges always comes, I'll speak this now as a community person in terms of how we start the grant making and all of the process and all those kind of things, because being in a country where homosexuality and the LGBTI issue is still a criminal in this country, it becomes a challenge, especially in terms of registration and also fundraising. And in terms of the donors, it has always been very hard, especially for community. The community organization, they log a lot of community organizations, and especially the young upcoming organization which are doing vibrant work, and especially look at an area like, for example, in Rodwa, where maybe somewhere in Masailand or somewhere where community are doing perfect job. They are doing everything that is required to be done by a donor, but they cannot even access that funding. Why? Because of the restriction that has been made by the donors. Like, you have to bring all the registrations, audited reports, especially the audited reports, 3 years bank statement, and the organization doesn't have a bank statement, audited reports, the issues of M&E, you have to be asked for monitoring and evaluation. How do you do all your monitoring and evaluations? So, and also the annual income budget, which this is a new organization which has just started. That is for me in terms of the grant application process that requires submission of multiple supporting documentation. I think that's something for me. I have always found it very hard for upcoming organizations. And in my experience, when it comes to the appropriate understanding impact on how we would like to work with the donors, it is about for the donors to see who, especially they keep on asking for data. I think it's all about numbers. What donors always think is, most of the donors only focus on numbers and data. Yet they overlook how the community has transformed over a period, e.g. maybe addressing adherence. For example, I might give up about an organization like Hoimas. How do we address adherence? So most of the donors overlook, and most of the time they tend not even to understand that this is a new organization. This is an organization that has been addressing the treatment through economic empowerment, creating jobs to some of the staff and livelihood, permanent shelters, nutrition support, and also support groups, and issues of especially the mental well-being of our community really matters a lot. So this is, for me, this is a very big concern, where a donor will always talk about numbers. How many people have you reached? Why have you not reached so many people living with HIV? And for me, it always shows that a donor wants numbers for people living with HIV. While at the same time, we are talking about prevention. We are talking about how do we do prevention. There is a lot of methods of prevention. So those are the words that for me, I really always struggle to understand. But that does not mean it's not part of capacity building, because the work of a donor is also to give the capacity to the community-led organizations. So through a process, sometimes it's very hard, but in between maybe a period of 1 to 2 years, it's always very easy for us. At least we get to know each other and we work together. And I really love how maybe when we come in terms of the reporting, well, maybe some of the donors, and especially the Civil Lewis Foundation, will always tell you, you need to report on this time. Where don't you understand? You can always get me on WhatsApp. We can agree and we can agree. And that is what, for me, is all about partnership. Partnership is not just about money. It's all about how you agree and how to help each other to build. And it's also a learning process. Maybe that's for now.
Thank you so much. Can I come back to you, Leah? What are some of the strategies you are using or engaging with partners who are deemed high risk? And how do you deal with that?
Yeah, I mean, I think, the term, we have to interrogate what that actually means. You speak about somebody being high risk. I think, again, conversations like that and terms like that undermine trust. Because what does it mean to be high risk? Just because folks have different ways of doing things that doesn't necessarily automatically align with a preconceived notion of what something should look like, does that make them high risk? Or is it that they do things in a different way, and in that difference, there's a learning that is to be done? And I think, accountability and transparency are important in the relationship, but how we get there matters. And the idea is to get there together without pigeonholing folks into a particular mechanism that doesn't feel natural and authentic to them, because that's when challenges occur, right? When you're trying to do something, when you're trying to fit a square peg in a round hole, because it's not authentic to the way that you work, that's when the breakdown and the challenges occur. And I think we need to do away with terms like high risk and just respect the fact that there's different ways of working. There's ways that are yet to be understood, and to be open to new ways of working, and to ask questions. I think if we develop a relationship of trust where we can ask each other those questions on a continuous basis, we can feel comfortable and confident asking each other those tough questions, and partners can feel comfortable asking us those tough questions as well. We can really come to a place of genuine understanding. And I think we should do away with terms like high risk. I really do, because I don't think they benefit anybody. It shuts people down. And it doesn't encourage conversation. People have different ways of working, and organizations have different ways of doing things that is unique to them. And there's a degree of mutual respect that's required to understand. Really trying to understand what that means for the people who are on the ground. Yeah.
Thank you so much, Leah, Dinini, and John. Definitely a lot of buzzword around trust. There seems to be a trust deficit in this partnership, in the way in which we impose types of accountability, ways in which we are asking partners to apply for funding. Definitely something that, in the principles, we need to, how do you build that trust in these procedures we are imposing, in the way in which we are engaging? And I like the ideas from Dinini that reporting comes in different shapes and forms. It's not just in the template, it's in the stories, it's in the impact. It's in how you do the actual accountability. I think I like that. Sorry, we took a bit of time for these principles because we're dealing with principle 3 and 4. For those who were wondering why is this session taking longer, we were dealing with how do we expand the traditional notions or concepts of how do we demonstrate our impact, but also we looked at the practical ways in which we are actually building this relationship in terms of how do you apply for funding, what reporting mechanisms. So we're dealing with 2 principles there. But we are moving on to the last principle. And the last principle will be discussed by Cecilia from VIV and Nicola. And they will be discussing how do we build partnerships with community-based organizations that extend beyond just funding. For example, thinking about how do we build bridges and learning opportunities and advocacy. I am avoiding capacity for obvious reasons, because I think the word capacity itself needs an alternative language, because again, the issue of feeling like it's an empty space for us to feel there is something that is there, but how do we bring in other things that supports what is already existing? Cecilia, do you want to come in, and Nicola?
Yeah, thanks, Vuyisak, and thanks, SLF, for this really interesting conversation. At VIV Healthcare, we provide 3 additional opportunities on top of the funding that they've received. And I loved how you said you're trying to avoid the word capacity development. The word that we use here is accompaniment. So we have 3 specific opportunities that we've put under an umbrella called Amplify Impact, right? Because we recognize that the know-how, the innovation, the capacity really does lie with the community. So we provide up to 10% top up of the grant that has been accessed by partners for them to do their own assessments and decide what area of support they want to put the money in. Could be anything around organizational development. It could be an area around HIV technical capacity. In addition to that, we do also have a linking and learning initiative where we have a peer-to-peer learning platform. So partners come together to share successes, to share challenges, to share their failures, right? And to troubleshoot together. Because again, as we said, we do know and we have seen that the capacity does lie in communities. So in the last year and a half that we've been working on this specific initiative, we've had partners come together to discuss what is working to reduce self-stigma, for example, what is working to support adolescent mothers living with HIV and their children, not just to survive, but to thrive. And the solutions really do come from the partners that we work with. The last area that we target around accompaniment and amplifying impact is what we call the Skills Connector initiative. And this is where we provide support from ViV Healthcare and GSK employees that have skills in 6 predetermined areas. So it could be providing support on communication. So looking at how do you package your communication assets. So support can last between 3 to 10 hours a year. I've had partners that have received support in analyzing their data, packaging it for advocacy, and this is done remotely. It's almost like just an accompaniment, a mentoring type of approach, but is really on an ad hoc basis and led by the partners that we're working with. And we have this type of initiative because we recognize the unique and significant influence that communities have had. Even in the last 2 years, no one on this call can say we haven't seen the importance of community in ensuring that we're still able to ensure that people in HIV have access to care and services. And like I said, it's not that we have learned it all and know it all. In our previous technical assistance framework, we got a lot of feedback from grantees around ensuring that ViV Healthcare Positive Action had a learning approach, ensured that there was spaces for peer-to-peer learning, and this is what then resulted into what we're now calling Amplify Impact, and those 3 areas. And I'll just stop there for now, Risaka.
Thank you so much, Nicola.
Thank you. What a refreshing webinar. Thank you so much. So I can honestly say at Jandiri, we wouldn't be anything like where we are, or perhaps even exist, if it weren't for the non-financial support we've received over the years. I mean, of course, the financial support is critical, but it's all the other bits that we've received from some of our funding partners that have been so critical in helping us grow and evolve, and indeed led to catalyzing further funding. So, I think whereas community health workers, and in our case, it's young peers, adolescents living with HIV, are directly contributing to such massive improvements in outcomes for people living with HIV. So many CBOs, including ourselves, may not have the same structures and systems to demonstrate that contribution and leading to that attribution. And so where we've been assisted over the years, and it really was for many years only by a few funders, 2 of whom are on this call, Viv and Elma, who helped us in this regard. And I was thinking of how to share the sort of different areas we've been helped with, but really it all comes back to storytelling. And I've loved hearing that come up through this webinar. We've been helped to better tell our story, better tell the contribution we are making to improved outcomes for the young people we're trying to serve. So that might be support for improving our M&E systems and structures, ensuring that our indicators, I often think some of our indicators were worded differently, but actually meant the same thing as what donors were prioritizing. And once we had a bit of tweaking here and there, people suddenly got it. They're like, oh, okay, so we now understand what you do. But help with our M&E systems and our tools. Documentation. We've had partners years back who used to say, make sure you document, and they would help us with that. And at first it felt like, another thing to do that wasn't funded. But actually, my goodness, it helped. And we love all that now. And it's a huge part of what we continue to do. But helping us to articulate and tell our story has been invaluable. And we've really struggled with that over the years, but we've been learning, and it means that people suddenly understand what it is that we're doing and how we are contributing in a way that other people get. And another one is giving young people the platform, I would say, visibility and advocacy platforms, again, with partners in this call. We've had young people as community health workers who have been had the most phenomenal opportunities to be mentored as young advocates and given global and national platforms to speak about what it is that they do. And that's helped to raise visibility and understanding of the contribution they're making. But importantly, also given those young people phenomenal exposure and skills, and many of them are now in professional careers in the field of HIV. I know time's ticking, so I'll stop there. But that's just a start from me.
Thank you so much, Cecilia and Nicola. I'm going to invite every panelist to show their video. To share some of your parting remarks, something that you really are burning to share, that you feel like it's missing in this conversation, or you want to really emphasize. I'm going to start where we've ended, maybe with you, Nicola, and then we can go to Cecilia along the way towards the first person who spoke. Any last comments or messages for the rest of us? And I guess, one would be, for me, is that, sure, you've all articulated that this is not an easy partnership, because it comes from a place where there wasn't any space for communities to engage in a partnership way with donors. And whether you call donors or partners, I need to also learn the language. The second thing is that we are now opening this conversation, asking donors to step forward in a courageous way, to engage with communities, to measure the work we do differently, but measure with us. And I think those are some of the ways in which we would like to encourage even big foundations, small foundations, to come to this conversation, because it requires, trust, courage, and convict that some of the things we've been doing are not the way that communities are asking us to do. So, Nicola?
I think we need to encourage our partners, donors partners, to support a different type of evidence. We have young people in Jandiri who actually wrote and produced their own song. And the chorus is that I'm not just a number, you should get to know me better. I'm not just a statistic. I can share the link with you. But yeah, I think it took us many, many years of trying to explain what we do. And really, people sat up when we did a randomized control trial. And that isn't acceptable. We can't all be doing trials. They're hugely expensive, they're feasible, they're not necessary. So I think, again, the storytelling, people need to listen to the stories from communities, listen to the stories from our community health workers, and really invest in that. Thanks.
Thank you so much. Cecilia, very quick.
I think for me, it's just to say how important it is to be vulnerable, to leave the ego at the door and just engage in conversation like this one that we're having here. Because if community-led healthcare was adequately acknowledged in science, in evidence generation, well-resourced, and not just seen as a good to have, then we will actually know what it means to leave no one behind. So
Thank you.
Step up, yeah.
Thank you. John? You are on mute.
For me, what I will encourage donors and partners is all about Genuine partnership is having a genuine partnership. It is not just numbers, it's all about human being. As much as people want numbers, let's also count that there's a human being. We need to be counted as human being, not just numbers. Thank you.
Thank you. Dinini?
Yes, I really want to emphasize that partners and donors consider community priorities and work together with them to build something that's important for the communities and of course for the donors or partners as well.
Leah?
I want to encourage funders to continue to invest in community-based organizations and community-based care. It is so critical to the work that the partners are doing, and to do so in ways that is respectful and meaningful, and trust the agency of those who know best how to do this work and to do it well.
Thank you. Godson?
Thank you very much. With me, I would appreciate that the donors would really prioritize the need of the CBOs, because the pilot persons who work directly with the clients. And in addition to that, it's just a concern to say, is there any possibility, as we're fighting against the HIV/AIDS pandemic, I'm looking at the other non-communicable diseases, which claims also a lot of lives. For instance, the same client, HIV client, might have something like diabetes, but if we are not looking into that, in some communities, people are living in a very remote areas. So for them to access medication for diabetes is always a challenge. And now is where it comes with the flexibility aspect, so that we can really assist them. Thank you very much.
Thank you. Ruth?
I think from a funder's point of view, it's important for us to be actively listening to what communities are saying are the priorities and action on them. That's quite important, and really tap into the potential of the communities to support or contribute to their own development. So really engaging, active engagement really with communities and community-based organizations.
Thank you so much, Justin. And then I'm going to end with Tomaida. Justin?
Yeah, for me, I think what I'll do is just to summarize what I actually said at the beginning, that what we need from development partners, I would rather call these funders development partners, is simply simplicity, flexibility, lenience, and a special consideration for CBOs, and even allow CBOs to engage effectively with their communities. And finally, maybe they should also adopt the community-driven systems change being championed by Firelight. And maybe just to add that home-based care is now even needed more than before, with what Goodson was saying. There's non-communicable diseases, the coming in of non-communicable diseases. It's really, really a great challenge. You can see quite a rising number of chronically ill people that need support in community-based health care. So I think this is high time we supported this as maybe development partners and work with CBOs together so that we can overcome these challenges and help the needed.
Yeah, thank you. Thank you so much. Tomaida?
Yeah, so I would want to wrap up by saying that there's need for us as funding partners to listen more and recognize that the CBOs have expertise that we can build on. So we need to listen more, engage with them more, and be willing to even the playing field so that we recognize the imbalances that are there and go an extra mile and challenge our own systems so that we shift power to the communities.
Wow. What more can I say in closing than saying thank you so much for allowing yourself to be vulnerable, because this is a difficult conversation, and hopefully all of us are going to be champions to engage other funding communities to begin these conversations, your partners, those of you who have access to that power, to engage, because only from here we can get better, we can achieve what we need to achieve. Because if we continue to avoid these difficult conversations, then we are not going to achieve, we're going to see the end of AIDS or end of poverty in communities. We do need these conversations to build from. Thank you so much, all of you, for your availability. And I'm handing over to Healy.
Thank you so much, Suseka, and to our fabulous panel. I will be very quick in wrapping up. I would just like to remind everyone that we do have a full document to go with this. It's brief and to the point, but it helps to expand on some of these principles. And so we encourage you to check it out. We will also be sharing the recording of today's event with everyone. I'd like to thank everyone who worked with us in this partnership and in the conversations leading up to this, including those who are not a part of the call today. And I would just like to end with a statement that's a part of the document. To realize universal health care and end AIDS as a public health threat by 2030, funders must increase their support for community-based organizations delivering community-based care, reflect on their own funding practices through an anti-colonial lens, and take concrete action to change their approach. We ask you all to join us in sharing this message with others, in continuing the conversation, and we look forward to being a part of that with you. Thank you all so much.